Hello, my name is Gina Guillen, and my topic is Evaluation of Diabetes in Self-Management in Ecuador and Other Countries. Definition is a chronic metabolic disease that affects how the body turns food into energy, characterized by elevated levels of blood glucose, which leads over time to serious damage to the heart, blood vessels, eyes, kidneys, and nerves.
Diabetes is a condition where your blood glucose level, also known as blood sugar level, is too high. There are two main types of diabetes, type 1 and type 2. There are also some rarer types, but they're all serious and can be diagnosed by your GP. The signs and symptoms you need to look out for are weeing often, because your body will be trying to lower your blood sugar levels by flushing out the extra sugar in your blood. This can lead to other symptoms, including feeling really thirsty or genital itching and thrush. This can happen if your wee contains a lot of sugar from your blood, because it can create an environment for fungal infections. You may also feel tired, because the sugar in your blood can't get into your cells to turn into energy. This could lead to your body trying to break down its fat stores instead, so you might find that you are losing weight without really trying to. Wounds might also take longer to heal, because high blood sugar levels can limit nutrients and oxygen from getting to your wound. And your eyesight might be blurry, as blood sugar can build up, making it harder to see. With type 1 diabetes, the symptoms can be more obvious and develop much quicker, over a few days or weeks. With type 2 diabetes, the symptoms can develop much slower, and some people may not have any symptoms. This is why some people can live with type 2 for years without realizing they have it. If you do notice any of the symptoms, contact your GP straight away. Getting diagnosed can be the first step to getting treatment and support, so that you can find ways to live well with diabetes as soon as possible.
Application in nutrition. The basis of meal planning involves portion control and favoring healthful foods. Keep an eye on carb portions because carbs do impact blood sugar. Add vegetables to every meal. Choose fats wisely. Follow a regular eating schedule. And consider checking blood sugar before and then 2 hours after a meal to learn how your food choice impact your glucose levels.
How can nutrition help manage diabetes? We're going to learn about balance and good choices. Nutrition plays a very important role in managing diabetes. It can help you achieve and maintain a healthy body weight, aid in blood sugar management, and also help prevent or delay complications of diabetes. And it's about the right balance that works for you and getting the appropriate amount of nutrient-dense foods and portion sizes. For example, one method we use to educate patients is the plate method. It's a plate that contains the 5 food groups. You don't have to portion anything out or measure it. You get your vegetables, your protein, and a healthy serving of carbohydrates. It's a simple concept, but not always easy to do. If you want more information, we can help you out. Good nutrition is important in managing diabetes. For more information, go to fordhealthcare.com/diabetes.
Ford Healthcare. For health.
Pros and cons. Pros. Diabetes self-management can reduce blood sugar levels, mortality risks, and healthcare costs, as well as weighting people with overweight. An intervention combining diabetes prevention and self-management helped to improve diabetes care through Ecuador and other countries. Cons. Lack of access to resources interfered with optimal diabetes management. Cultural beliefs, personal control, and low health literacy influence diabetes self-management patients with limited resources. Issue applied in Ecuador. Ecuador indicates an alarming prevalence of diabetes. In the last 2 decades, the incidence of diabetes has increased exponentially in the country. 5% of adults from Ecuador are estimated to be living with diabetes, and 40% of people don't know about their condition. Diabetes currently ranks as the second direct cause of mortality in the country. Since 2000, the number of diabetes-related deaths has increased by 56%. Conclusion: diabetes is a complex disease that requires the person to make numerous daily decisions regarding food, physical activity, and medications. It also necessitates that the patient be proficient in a number of self-management skills. Comprehensive diabetes care can delay the progression of complications, maximize the quality of life, and minimize the healthcare expenditure.
Welcome to Your Health with Joan London, presented by the Centers for Disease Control and Prevention.
Hi, I'm Joan London. Diabetes is a growing epidemic in this country, affecting more than 29 million people. The management of diabetes can be overwhelming to some. I'm joined by Dr. Ann Albright, Director of the CDC's Division of Diabetes Translation, who lives with diabetes every day and has to manage it. What's the hardest part, Ann, of managing diabetes?
Well, I live with diabetes most of my life, and it absolutely takes effort to live with diabetes. You have to pay attention to your food and being active and taking your medications. But everything that you do to manage it is worth it.
Yeah, you really have to kind of embrace the lifestyle, right?
That's right.
But 1 in 3 Americans may develop this some point in their lives. But there are things you can do to lessen your chances of getting type 2 and just to make living with diabetes easier. Walk us through some of those.
In taking care of your diabetes, it really is critical that you are establishing healthy lifestyle habits, eating healthy, certainly getting less sugar and salt, being active, being physically active, working closely with your healthcare provider. Be sure to take your medicines as prescribed, and certainly check your blood sugar regularly. It's absolutely critical as well that you get diabetes self-management education. That's really the key to learning to live well with diabetes.
And you say everyone needs to know their ABCs. What are those?
A1C is a blood test that lets you see how your blood sugar control has been over the last couple months. You also need to get your blood pressure checked. You need to get your cholesterol checked, and certainly stop smoking and never start if you haven't.
But really important, you should try to find the support of an educator and a group like the Diabetes Self-Management Education Program, and involve your family as well, right?
Absolutely. You need to be sure your family's involved and that they also get the support that they need.
All right, Ann, thank you so much. It is a team effort, and that does include family and friends. And there are also wonderful diabetes educators and online support groups to help you keep on track. I'm Joan London. Thanks for joining us.
Sponsored by NACDD with support from the Centers for Disease Control and Prevention. Visit cdc.com/diabetestv.